very much for the introduction, very generous introduction. Thank you for listening, audience from around the world. Um, there's sort of few points just to say I hope everyone's well in these strange and challenging times across the globe. It has certainly been one of the most busiest times for my field, mental illness, psychiatric conditions, and generally speaking, well-being for human beings during these challenging times. Um, I've I've never been busier, and it's not really quite good for humanity to be suffering so much. Just want to sort of zero down on a few points which relate to diabetes or such illnesses which are chronic, pervasive to a lifespan of human beings, and certainly plague the Asian community quite a lot, and the impact that can have on our mental well-being. Um, we call these conditions chronic or long-term conditions, which means sometimes there's a easy sort of route into managing it, treating it, or dealing with it throughout your lifespan. But there's certainly a larger level of manageability and shifting one's mind to dealing with such a condition when people are either first diagnosed or consequently have to manage different stages and progression. Um, when a human being, when a person, individual is, it has to deal with something that affects all angles of their life, right from sort of the basics of nutrition, exercise, how they live their lives. Their sort of impact can be on, largely speaking, the way you think about your life, nutrition, diet, lifestyle management. And we call these larger sort of thoughts, we call these mindsets. So you may have been living with a certain way of your food, diet, lifestyle, everything, and suddenly here comes diabetes, and you have to change the way you think, perceive, think about food, think about your body, think about your health. And it can have quite a huge impact. People certainly express and um, may suffer from stress or anxiety, which comes with having a long-term illness or condition such as diabetes. Um, the comorbid issues of diabetes create another complex array of issues for human beings, which means all the sort of other ailments which can or may not come along with diabetes have a real impact on quality of life. So we're talking about mindset shifts. So people have to rethink the way they're living life. Now we're talking about behavior shift as well. So it may impact the way you've been living or managing day-to-day life, or aspects of your life that are very sort of special to you. Either you're passionate about something, or your life behaviors, the way you interact with life can change, especially if you have comorbid illnesses and conditions. That again places a huge amount of stress, or at least a huge amount of effort in shifting the way you manage this, one manages this condition. So if we think about the human mind, these are the two huge components of our mind: our thought system, the way we think about life, and our actions or the behaviors we engage in. And it can have a huge impact on both these systems. And of course, the third angle of our sort of mental well-being is how we feel. We're not in the habit, in the Western world or Eastern world, we're not in the habit of asking people, how do you feel about this diagnosis? How do you feel about this condition? What's going on for you? Does it impact you in an emotional way? We often check blood sugar. We will make sure that they're eating well. Doctors will be on your case if you have other comorbid illnesses, but we're not stopping enough. And I think that's my sort of kind of key point to loads of people is, if there is a major shift in the way your health is affected, let's take a pause. Let's all, sort of think about, the impact on how it makes a person feel in general, whether it's, Are you coping, which is great? Are you stressed out about it? Are you anxious? Does it create? And I think, let me throw out a few really key points, given we've all been living through a pandemic. Illnesses or diabetes creates a level of uncertainty in human beings, and as human beings, we're not used to, and we don't like change and uncertainty. It creates an existential question of, what's happening to my body? How much control do I have with my body? Aging, illness, death, dying, all these are existential questions that it raises in a person. And I think we need to make more time to help people explore the impact of such conditions on existential questions, their feelings, fear of uncertainty or unpredictability of what may or may not happen, so that they can empower themselves and take the right steps to help them build whatever certainty may mean to them at that point in their lives, whether it's a good nutrition plan, exercise plan, crisis management plan, support from the family, support from peer groups and communities such as this. And I think, to me, those are the three big angles of one's mind. I often say to people, as a psychologist, I work with a lot of children, and I often say to them, do you know what the difference between your brain and mind is? But would anybody, we don't think of this difference, but if you think about it, your brain is the structure. It's in there inside your skull, quite protected, and you can x-ray it, you can MRI it, you can scan it, and you can see the different regions of your brain. Can we see our mind? What flows inside your mind, what flows inside your brain, apologies, is your mind, and we can't x-ray it. However, CBT, one of the treatments we practice, makes it very easy for us to x-ray our mind, which is, our thoughts, our behaviors, and our feelings. And I think that's the sort of approach I often use or identify with, or help people identify to understand what's going on for them. What's going on in your mind? What are you thinking? What are you feeling? What are you doing with this? Whether it's a pandemic, diabetes, or some other illness, how is it impacting your whole system of, your mental world, your internal mental world. I would like to wrap on that note, even if it's not 10 minutes, because um, it's quite a rich concept in itself, and we can open our discussion or questions and any other thoughts based on this kind of three-dimensional model of understanding your mind and using it in order to help you or help individuals deal with the impact of long-term pervasive conditions.